This is Scott Becker with the Becker's Healthcare Podcast. Thrilled today to be joined by a brilliant leader, Jonathan Wiik. We're to talk to Jonathan today about his most recent book, and he's authored a couple books. He's really a leader in thinking about healthcare finance, healthcare payment reform, and a lot more. Today, his book is called Healthcare Evolution, Helping Providers Get Paid in an Era of Uncertainty. His earlier book was Healthcare Revolution, the patient is the new payer. So in addition to a different subtitle, he also dropped the R. So this book is called Healthcare Evolution, Helping Providers Get Paid in the Era of Uncertainty. John, tell us a bit about yourself and your career, Jonathan, and then let's talk about the book and some of the major core things that come out of it.
You bet. Thanks, Scott, for having me. I started as a hospital transporter, believe it or not, pushing wheelchairs around a hospital long before I had kids, a mortgage, and gray hair. I think worked my way up through admissions and billing and became a chief revenue officer at a $500 million acute care hospital, and then have transitioned in the last probably third of my career here into consulting and work for FinThrive now as the VP of Healthcare Industry Insights.
Thank you. And take a moment and tell us about your latest book and what drove you to write it.
Yeah, I think the first book, people really liked The Patient's the New Payer because it kind of talked through where healthcare came from and how we're like one of the only industrialized countries that attaches insurance and benefits to your employment out of World War II. And it talked through like all the problems. I got a lot of armchair quarterback comments, Scott, about it. It's real easy to sit in your chair and talk about, well, that's wrong. And I wouldn't have done that. And boy, that really is awful. They said, why don't you write a book on how to fix it? And that is what the second book is about. And that's why I did drop the R. It's kind of, we need to evolve as an industry and really rethink how we're managing our revenue from patient and payer. And there's some strategies and things in there. And it is an uncertain time. It came out right before COVID, but the title plays now because I think it's very uncertain.
And take a moment on what are some of the key things that should change or need to change. You already mentioned sort of, and talk about that. We are one of the few industrialized countries where insurance is tied to your employment, and that leaves people very beholden to it. There's been sort of legislation to try and change it. It's not been very effective. What are some of the things that should be changed?
Yeah, the book has kind of four big categories. And I before I started talking to counsel, and you're an attorney too, I removed the HE double hockey sticks references. But what is going on? I had what the hell is going on? And why is this such a complicated industry when you look at other ones? Every industry is complicated, but healthcare seems to be checking all the boxes in terms of frustration, antiquation, lack of collaboration, and anything else. So I think some of the things we need to work on is just being more collaborative. One of the things I heard at your conference, even just 3 weeks ago, was, payers aren't the enemy. The status quo is the enemy. The system, frankly, would not survive if there wasn't a third-party payment system, just because, I don't know that the American public could afford, without a huge tax base, first dollar coverage. And they are there to manage care and help make those things accessible. And we've got to look at that. And we've got to quit paying by the hour and start paying by the job. And what I mean by that is exploring value-based care and having hospitals and health systems start to assume risk where they feel it's appropriate and actually have skin in the game instead of being paid for episodic sick care, which is what we have today.
You talk about the biggest payers, and I was looking at this list yesterday. The 15 largest companies in the U.S. by revenues, 3 of them are payers. I mean, CVS Health is 4th, United is 5th, Cigna's I think 14th or 15th. They're right in there. How do you sort of look at that? How do we get to a spot where they're so important, and they're not going away because literally 14% of the payers Medicare, 50%. 35-40 is Medicaid. We still got about 50%, something around there that's commercial pay of some sort. But how do we make more sense of the system?
I think you're starting to see the payers, test the waters a little bit more with providers, Scott, in terms of creative contracting. And I think the provider market needs to be just a little bit more flexible when it comes to those things. Hey, let's assume some risk together. Let's try to reduce average length of stay. Let's try to have lower utilization of high cost imaging. Let's remove waste. New England Journal of Medicine just had an article come out about waste. Let's start sharing data and be more collaborative. Let's open up the EMR. I heard that at the conference as well. Let's look at, admission criteria together and decide collaboratively if it's an inpatient or observation patient. Let's remove authorizations. Let's reward those that are utilizing appropriately with gold card programs, and let's just not reimburse anything for ones where it's the sixth MRI in 8 weeks, for whatever the reasons. I think that data share with these large companies is where it's going to start to become much, much more collaborative, and I think will be more innovative and transformative as an industry. We've been very guarded and siloed on kind of the empire of patients, the empire of employers, the empire of the government, and the providers, and a lot of data hasn't gone back and forth. And I think there's a key in understanding social determinants and continuum of care, and also just reimbursing on outcomes versus on diagnosis.
And Jonathan, let me ask you another question, because you're both a wonderful person and a really smart guy. This book, the most recent book, is something like 410 pages. I happen to have it in front of me. Your other book was equally long. Where do you find the energy to do this, and what advice do you have for people on finding passion and maintaining the energy level they need?
Yeah, it looks harder than it is. I think you're a talkative guy too, Scott, right? So it's a matter of having someone smarter than you organize your thoughts into something that's readable. I heard people say that they really do enjoy reading the book, which is quite flattering and humbling. I think it was pretty scattered when you put it together. My advice to answer your question is, I think there's a lot to be said about healthcare and how to fix it, and we all need a voice. And I've been very blessed to have the book be that voice in that channel in the market. But I encourage those that haven't had one to get on podcasts like this, or get out and speak, or attend conferences, or participate in publications, and really share those ideas and solutions, because I know they're out there. We've got a wonderful country. We've got a wonderful healthcare system. It's getting a bad rap. And I do think we can control costs and better outcomes if we just start sharing ideas instead of arguing with one another. I do think there's huge opportunity in that. And that's where I find the time is I'm just passionate about it getting fixed. And I know we can. We just have to lower our guard and be more flexible.
Thank you very much. And one more question, and you don't have to answer this. Is being a whitewater instructor harder or easier than raising a couple kids?
I would say it was a little bit easier. My kids are both teenagers now, Scott. And so, I'm an ATM machine to them, I think. But whitewater guide, that was probably, I'd do that job today and instructing people was really fun too. But it was the funnest job ever. I think I would do that job today if it paid the bills. You got a tan, you got to yell at people all day, and you were in the mountains, and it was glorious, and it was just a really fun job. And one of my favorite things I got to see is these guides that had never, driven a boat or understood how rivers work, and they're entertaining people from Kansas and Indiana that had never even seen a river before of that magnitude, and enjoying it all the way and keeping people safe and doing a good job at it. It was really rewarding.
That's phenomenal. You joke about being an ATM machine to the kids, and of the 6 kids that we have a blended family. There's one of them, and I'll call her out on this, that only texts when she needs money, and she's in big trouble. No, she's actually the youngest, and of course, she's the favorite, so it's okay. She can get away with it. But I do. She's not really the favorite. Everybody's the favorite, of course. Jonathan, let me ask you another question. Where can people find out more about the book, and where can people learn more about you?
Yeah, I think, I'm out on LinkedIn, so my last name's kind of interesting. It's 2 I's and a K. So if you look for Jonathan Wiik, you'll find me out there. Connect with me there. That's honestly, I'm posting a lot of, thought leadership out there. I put a podcast out. I just did a report, Scott, on labor and what's going on with that. I put a financial outlook report highlighting some of the work Kaufman Hall has done on a report that they had in the fall. A lot of the stuff your team's doing at Becker's, I'll cite as well. I'm a data nerd. I like to go research, and LinkedIn's kind of been my carousel of education, and that's probably the best place for folks to connect with me.
So Jonathan Wiik, one other question. You've got another movie coming out. Any thoughts on that?
Yeah, it's funny. Whenever I get that, every time I check into a hotel, Scott, they're like, "Oh, wow." And I'm like, yeah, I tell them 2 things. Don't mess with my dog. and 2, I wanted Brad Pitt. Keanu Reeves doesn't really have my likeness. I think Brad Pitt looks a little bit more like me, but the studios just wouldn't agree. But I'm not Russian, I'm Finnish, but the movies are entertaining nonetheless.
No, 100%. And you're right, though, because Brad Pitt's hair coloring is closer to yours. You are right. You were improperly cast. We'll have a word with the studios. You need a lawyer for that.
Absolutely.
Anyways,
I'll call you.
Thank you very much, John. A pleasure to visit with you. Magnificent work. Again, healthcare evolution, helping providers get paid in an era of uncertainty. Just phenomenal. Thank you so much, Jonathan. Again, Jonathan Wiik.
Thank you, Scott.